Hello, everyone. It's Friday, April the 22nd. Sorry we're with you late in the afternoon, as late as it is today. We've been to one of our wonderful state parks this morning, and it's our North Bend State Park, and I'll tell you a little bit more about that later on, about some real big-time renovations that have been done up there, and everybody knows, all the success story of all the great stuff that we're doing within our DNR and tourism, and we had our DNR director, Brett McMillian, and our Secretary Ruby with me today, and it was a good day, really good day, an incredible facility and everything, and lots and lots and lots of good stuff there to come, and I'll tell you more about that in just a second. We've had an additional 19 deaths in West Virginia. There are 14 of these 19s that are reconciliations, and so really and truly the death number is really 5, and so with all of that's happened in the last few days, we celebrate only 5, but at the same time we pay all of our respect to all these folks, and the other thing is only 5 is absolutely 5 too many, and we know that. The 6,805th death in West Virginia is a 62-year-old female from Braxton County. The 6,806th death is a 66-year-old female from Wyoming County. The 6,805th death is a 62-year-old female from Braxton County. The 6,806th death is a 66-year-old female from Wyoming County. The 6,807th death, a 73-year-old male from Kanawha County. The 6,808th death, an 83-year-old male from Fayette County. The 6,809th death, a 79-year-old male from Randolph County. The 6,810th death, a 72-year-old male from Greenbrier County. The 6,811th death, an 82-year-old male from Raleigh County. The 6,812th death, a 75-year-old male from Kanawha County. The 6,813th death, an 82-year-old female from Calhoun County. The 6,814th death, a 62-year-old female from McDowell County. The 6,815th death, an 85-year-old female from Logan County. The 6,816th death, a 56-year-old female from Berkeley County. The 6,817th death, a 94-year-old female from Pendleton County. The 6,818th death, a 94-year-old female from Kanawha County. The 6,819th death, an 86-year-old female from Berkeley County. The 6,820th death, a 71-year-old female from Summers County. The 6,821st death, a 65-year-old female from Marshall County. The 6,822nd death, a 66-year-old male from Wetzel County. The 6,823rd death in West Virginia is a 93-year-old male from Mason County. Please don't let them become just a number. We have 544 active cases in West Virginia, 172 new positive cases in the last 24 hours. Daily positivity rate at 2.81, cumulative rate at 8.12. Recovered cases are north of 492,000. 86 people that are hospitalized with COVID in West Virginia now. 21 on the ICU units and 10 on ventilators. We do have 2 yellow counties in West Virginia, and the whole rest of the state's green. We continue to make slow but sure headway. Now we're up to 90.6 people, percent of the people that are 65 and older in West Virginia have gotten 1 dose. I think I mentioned before that we're at 72% of the 18 and older with 1 dose, 83.3% of the 50 and older. We still need this number to go up, but we'll be thankful for the blessings that we do have, in that we slowly but surely continue to move up. Now I've got three announcements here. I'm going to bundle them all together. They're pretty daggum important, but the request for proposals, the RFP posted today, soliciting bids for consulting contract to provide an organizational assessment from top to bottom, a top to bottom review, as I promised, of DHHR and a strategic plan moving forward. Bids are currently due on May 6th at 1:30 p.m. And so we look forward to, hooking up with a really, really, really great firm that can do an assessment from top to bottom of all the needs in DHHR. And if we have deficiencies, we'll address those deficiencies as I promised. We want to continue to try to make every single one of our organizations better. Now, I would add just this. Every breathing, living person knows that DHHR did not just get this way on my watch or in the last few years. There is no possible way. Really and truly, DHHR has had problems for a long, long, long time. The great thing is we're addressing them now, and we're going to try to get to the bottom of it and see what we can do to really help. We finally got the dollars coming in from a surplus standpoint to be able to do something. All we've been able to do in the past was cut, and cut more, and you couldn't do anything. Now there may be a real possibility to really even help more. But we'll be addressing that very soon. This evening, I will be issuing a special session call. The session will begin this coming Monday. There's no point in going into any more detail on that. From the standpoint of our National Guard, President Joe Biden has extended the 502F federal support for the National Guard, and it runs through the end of September. We're thankful for that because these great women and men need to be paid. I mean, that's all there is to it. It's, for what they do, in every way, from dealing with all the COVID situations to all the disasters that are all over the place to fighting for our freedoms. We need to absolutely step up and always help these great men and women. Another announcement that we have, I am very proud of this, but I am proud to announce that West Virginia will be stepping up yet again to aid in Ukraine's defense against Russia. Our National Guard is going to provide armored personnel carriers known as M113 APCs to the Ukrainian forces. These armored vehicles are used to move soldiers and equipment across the battlefield while providing protection from small arms fire and the efforts of artillery. Now, listen, the bottom line of this whole thing is just one thing. We have to step up. Americans have to step up. The Ukrainian people are hurting, and we should have stepped up long before this ever happened. But it gives me incredible, incredible honor and privilege to be able to see us at our National Guard doing just this. So these, we can't tell you exactly how many and how fast these are going to move, but they are going to move immediately. And so with all of that, we just offer up our prayers for all the Ukrainian people, and we hope to God above that this will stop and stop now. But if it's not going to stop, in my opinion, let's win the game. Let's win the game. I mean, for crying out loud, if it's not going to stop and Russia's going to continue to be Russia in this situation, let's send them home. Let's send them home and win the game. So if we're going to play and somebody's going to throw rocks, well, let's throw them back even harder. So nevertheless, I congratulate our military and I congratulate the National Guard for all they're doing. Let me go back to COVID stuff and remind you again about your boosters. And absolutely, you have got to get those booster shots. They're available to you right now. If you're out of the window when you need a booster shot, go get your booster shot. I mean, for crying out loud, it is just not wise. I mean, I don't know any other way to say it. It is not wise for you to be walking around and absolutely be over the age of 50 and literally be walking around and without any protection hardly at all and get this dreaded killer and then maybe suffer possibly at least the awfulest death that you can imagine. Let's don't do that. Let's just don't do that. The vaccine calculator is up. It's doing great work and everything. We thank WVU. We thank Dr. Marsh. We thank, General Hoyer, all the people that put in the licks there. Like I've told you about the second booster, it's available to you. The COVID-19 vaccine info line is all up where there's all kinds of information there if you need it. All the free testing's available to you. We have 25 outbreaks in our long-term care facilities, none in our church community, 13 inmates and 2 staff cases in corrections. From the standpoint of our rental assistance program, it's still there. It's still available to renters and landlords with permission from the renters and everything. You need to take advantage. This is real dollars. The new homeowner assistance program is still available. It is absolutely officially open now. Please take advantage. It is absolute major money. This is major money, and absolutely all West Virginians that feel like that they could qualify ought to at least call this office and see that you can qualify, or that there is a possibility you can qualify. I remind you about giving blood. Really, really important. Really important. I remind you about how successful our Jumpstart program has been. We copied this from Oklahoma, but in that, really and truly, we have had 14,605 people that have contacted us. 12,000 plus of them have qualified. And not only that, we've got more jobs in West Virginia right now than we have people that are unemployed, period. And I think the numbers are 50,000 new jobs that are out there and 38,000 are unemployed, but maybe, just maybe, a whole pot full of them will take advantage of this, and we'll get more and more people back to work for our small businesses, but more importantly for them. At the end of the day, I go back to the 2 ladies at that drive-through window and how proud they were that they were back to work. They were looking forward to their $1,500 check, but more than anything, they were proud of themselves. And absolutely, they'll go on to continue to do greatness, we hope and pray, but absolutely with all in me, they were really, really, really beautifully excited young ladies that were on their way to doing good stuff, and they were really, you could see it all over their face. They're really proud of themselves, and that's really good. Okay, the CDBG grant, program that was just out and everything, we just approved $5.7 million in federal grant funding for several of the COVID relief projects in Hampshire and Mineral counties. These funds, are funding activities in the public health service projects, and along with expanding community health facilities to address this terrible killer and terrible, disease. Now, with all that being said, I congratulate all the recipients, and all we want to do is continue to be on our toes, better prepared, saving lives, running to the fire, and doing all those things that we've said over and over and over. Now, this is great stuff. Communities in schools. They gave away their first therapy dog at the Welch Elementary School just a few days ago. The kids at the school properly named the dog Cole. It was a black lab, and absolutely it is amazing how well trained and how disciplined this dog, but you can see it in its eyes how caring it is for kids and caring for people. Now, with that being said, they gave their second therapy dog away yesterday, at the Buchanan Academy Elementary School. And the school held a pup rally that welcomed their new 4-legged classmate. His name is Foster. And look at that picture. I mean, gosh, how can you not love a dog? But look at that. Just look at that. Now, does that not make you smile? Does that not make you feel good? And if you're a kid, and in today's world, kids absolutely are faced with so many difficulties and so many problems. Look at this. I mean, does that not get any better? I mean, how can it be any better? And really, at the end of the day, we want to help our kids. We want to cut back on the anxiety, cut back on the stress, give them an opportunity to learn more and everything. And these therapy dogs, I absolutely salute in every way all the great work that Communities in Schools is doing. I'm not saying it because, Kathy, the First Lady, came up with this and is running with this, but I am telling you, I've been around a lot of programs, a lot of programs in schools, and there's nothing that I've seen that's working like this. This is good stuff, and they just keep pouring it on and doing more and more good stuff. Kathy and I both wish that we'd have been there yesterday when they gave away this golden labradoodle, but nevertheless, Kathy was a little under the weather, and I just couldn't make it. Baby dog wanted to come too. Kathy's told the kids there, she was on a Zoom thing with the kids there, and she's told them that she'll be there within the next couple of weeks, and I'll sure try to get up there too, but a really, really, really good day. The other thing is Communities in Schools has additional dogs that will soon arrive and be delivered to Green Bank Elementary Middle School and Pocahontas County and Lewis County High School. And also in the summer, they'll have another one for Hardy County. And so all this program is just moving along in a really good way. And I couldn't be more proud of them and more happy for those schools. And what we want to do is just continue to take requests and see if we can get the dogs and more opportunity to bring more goodness to our kids. And at the end of the day, I don't know that we've got anything in the world that even approaches how important our kids are. With that being said, I've got the only other thing that I have to offer up here is just one thing, and just tell you a little bit about what we did this morning. We were at North Bend State Park this morning, and like I said, we were joined by Brett McMillian and Chelsea Ruby, and we cut a ribbon right there, that is basically a remodeling of the facility, and in many different areas. It was $4.5 million for the lodge renovations, $500,000 for cabin renovations, and $700,000 for two new shelters. It really absolutely just upgraded that place in a big way. Now we know, do we not? Let's be perfectly frank and absolutely fair. We know, since we moved in this endeavor to spend $151 million on our state parks, what's happened? It is off the chart, the number of people that are coming to West Virginia. Tourism is absolutely exploding all over our great state, and it just keeps growing and getting better and better and better. Absolutely, we needed to show everybody what an incredible pond that we have in West Virginia, and show the people the real gift, just how good our people are. We needed people on the outside of West Virginia to quit making the bad jokes about West Virginia and be proud of who we are, and start all of a sudden, and of all things that are so unbelievable, believing that we're the diamond in the rough that everybody missed. I congratulate all those, from Secretary Ruby to our director, Brett McMillian, to all those that have absolutely done incredible work. But with all of that, I say just this, I appreciate Steve McDaniel. Steve McDaniel was heading up the DNR, and all the great work Steve did, and now Brett is at the helm and doing all kinds of phenomenal work. All those in economic development, from Ed Gaunch, and I'd ask you to just remember Ed. Ed's having a little bit of a tough go right now, and he needs your prayers. And absolutely an incredible man, just doing an unbelievable job. But now, with all that being said, let's go back to just this. Can you imagine whether it be Time Magazine or Lonely Planet, and I'm gonna forget some, maybe I've got it somewhere here in my notes, but all kinds of these national and international travel publications have said, of all things, can you imagine from where we've been that today, all of a sudden you're getting this unbelievable attention, that is basically coming out and saying over and over and over, West Virginia is the place to go. West Virginia is your travel destination. West Virginia is the place for families. And today, on top of all that, you know who added to the list today? CBS came out this morning and said, absolutely, West Virginia. West Virginia is your destination. It's great stuff, great stuff. Lots of congratulations to everybody. And I am so proud, like I said, to be a small part. So proud of all the great stuff that's going on in West Virginia in tourism and everything. Thank you so much. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
The COVID numbers are continuing to trend well for us. We know that, however, data from the CDC helps us understand that this is still a disease that has caused now the third most number of deaths in the United States in 2021, which is really quite stunning. And we also know that if you compare 18 to 29-year-olds, and you start to look at them as a reference group, then people that are 65 to 74 years old have a 65 times higher risk of death than the 18 to 29-year-olds. People from 75 to 84 have a 140 times risk of death. And people that are over 85 years old have a 340 times risk of death. So it makes it really, really important, as we talk about over and over again, that particularly our elders pay a lot of attention to your vaccine eligibility and make sure that you're using the vaccine calculator so that you are getting absolutely up-to-date vaccinations. And there's a lot of nomenclature, how we refer to things, but if you're eligible for another dose of the vaccine, then we want you to take it, because we know that the vaccines are really, really important in reducing your risk of death and hospitalizations. There is a new form of COVID, a subvariant of Omicron that is the 2A.12.1, and I'm sorry, the BA2.12.1, and that is now replacing the BA2 variant in a number of areas at a very rapid speed. It seems to be no more severe than other forms of Omicron, but it does tend to spread easier. So if you are older, if you're immunocompromised, or if you haven't caught up on your doses, really important to take that opportunity to do that now, because it's also been now figured out that COVID is likely the most infectious respiratory virus that we've seen for our entire lifetimes. And that's just based on the fact that it continues to get more and more and more infectious. And when we look at our numbers, they still look good. But when we look at our RT score, our reproductive score, it continues to go up very slowly. It's 1.11 today. So it's really important for the people most vulnerable to pay a lot of attention and make sure you're protecting yourself. And by doing that, you protect all of West Virginia. Thank you.
All right, thank you, Dr. Marsh. Next is Secretary Bill Crouch with the DHHR.
Mental health problems that have been brought about by this virus. Mental health is just as important as physical health. These are trying times for all of us, including our young people. This week, DHHR's Bureau for Behavioral Health announced grant awards to 19 schools to provide expanded school mental health programs, services in those schools. These awards bring the total number of schools receiving grant-funded ESMH services to 93 schools across 30 counties in West Virginia. These services help students thrive while improving the overall school culture. This is a great example of one of our bureaus assisting the Bureau of Social Services in providing important services to our children in the state. These are not the only services, mental health services available. The Bureau for Medical Services is also on board, and as I previously mentioned, obtained a Medicaid waiver to provide mental health services for our children in need. The ongoing stress of the pandemic on top of other day-to-day issues can leave us overwhelmed. If you are experiencing stress that gets in the way of your daily life, talk to a healthcare provider. I also want to remind everyone of the free 24/7 hotlines that provide guidance to callers who need help for themselves, as well as guidance if seeking help for loved ones. These hotlines also provide access to a comprehensive list of state resources for social workers, nurses, and others involved in discharge or care planning. If you or someone close to you needs help, please reach out. Thank you.
All right, thank you, Secretary. Retired Major General Jim Hoyer and Dr. Ayn Amjad both had prior engagements today and will rejoin us next week. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to get a little bit more information about the consulting contract for the DHHR. So, Governor, I know you said that the bid deadline is May 6th, but could you tell us what's going to happen after that? Do we have a date that we plan to award it? Do we know, the length of time of this study? Also, do we have a budget for this contract? Is that going to be a DHHR cost or a general fund cost? Thank you.
Well, Charles, I'll pass to Bill Crouch in just one second, but I would tell you this is if we get these bids in on May the 6th, I think it'll probably take, a little bit of a timeline to evaluate the bid to make sure that we're selecting the right person. To be perfectly honest, Charles, this is the kind of stuff I've done my whole life. I've got a lot of experience and hopefully we can pick the right group. But with all of that, surely to goodness, and within 10 days or 2 weeks, we can select who we think is right, and then we can get them on the project immediately and everything. And I don't really have a defined timeline as far as how long it's going to take for them to do the work, but I'm sure we'll get that in the bid process. But like I said over and over, there's nobody as impatient in life as me. So I want it done, and I want it done right now. But Bill, maybe you can give some more details.
Yes, thank you, Governor. Yeah, we are moving this process just as quickly as it can be moved in government, Charles. And the process is essentially, once those applications are in, they will be scored. There will be a process with a scoring team that goes through each application and makes sure that the scoring by the various portions of the applications are done appropriately. There will be no one from DHHR on that scoring team, by the way. We will make sure that is done independent from DHHR. As the governor said, we hope to get a good applicant in place to do that. If there are 20 applications, that may take a week or even a little more. If there are only 2 or 3, it may take 1 or 2 days. We will move that process along quickly. We're looking to have recommendations by December 31st of this year. So it's a tight time frame and a big job. So we've pushed this out. We identified 10 or 11 companies, national companies that appeared capable of doing this or had done this in other states. But it is being put out on Oasis for everyone. Any consulting firm out there that would like to bid on that, we welcome their bids. In terms of the cost, I'm not going to push a cost out there, Charles. Clearly, if I gave a number out there, the applications would come in around that number. So we're waiting to see what we get on that. We never disclose the cost that we've budgeted for a contract of this nature. But we, again, are very hopeful we're going to do exactly what the governor says. Governor wanted us to push this, and we're pushing it extremely fast. But we're going to make sure it's done properly and make sure it's done right. So thank you, Charles.
And Jordan, come back to me just a second. Not to correct Secretary Crouch, but there's no way on God's earth I'm waiting until December 31st to get these recommendations in. We're going to get them in way, way, way before then. We're going to do the work right. but this idea of waiting until December 31st or it lasts until December 31st, there's no way. No way. I can't tell you exactly when that's going to be, but it's not going to be December 31st.
If I could, if I could, we are getting monthly reports and progress reports. The final, very final report may be due then, but we'll have good information and clear recommendations prior to the final report being done. So, but we'll speed that up just as you said. Thank you.
All right, thanks, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Good afternoon, Charles. I'd like to get to where we are in vaccination status in real time. Obviously, if you have not gotten your booster, you're not being protected. Do we have a working number of how many people out there, maybe even a percentage-wise, that have gotten shots but are not boosted and therefore are not protected? As a interagency panel, what numbers are you looking at that tell you what we are as a state as far as being protected against COVID-19 and another surge? Thank you.
Dr. Marsh, you're going to have to take this one. This is way out of my pay grade.
Well, thank you, Governor, and thank you, Paul. You know, Paul, you're bringing up a really important point because we know that we are following booster shots very closely. And as opposed to the country that has a booster rate under 30% now, our booster rate is 47%. So it is much better. The real challenge that we're having, and we're looking into this, and I will also ask Secretary Crouch if he wants to make a comment, but is to try to separate the second booster shot, which will be the fourth shot for people that are eligible. And just as a reminder, people that are over 50 years old and are greater than 4 months from their last shot are eligible for a fourth shot, a second booster shot, as well as people who are immunocompromised at 12 years old and over are eligible for another booster shot, which if they're immunocompromised, it's a little confusing, but would be their fifth shot. So that's the reason why the vaccine calculator is so important. We are working actively to try to separate the people with the current booster shot, say, versus people that got the booster shot 4 months ago or before, and we're tracking that. Good news is we are definitely on the booster side higher than the national average. We are also doing much better in the elder part of our population, the over 65-year-old group, which is really good as well. But at this point, I do not believe we can absolutely separate the first booster shot from the second booster shot. Bill, I don't know if you have any other comments.
No, that's absolutely right, Clay. In fact, CDC has not made that distinction in terms of their tracking of the boosters. So we always wait on guidance from CDC because of the system that is in place to compare states, and they have not broken that fourth dose out yet either. So unfortunately, we're kind of where we are with regard to tracking these boosters.
All right, thanks, Paul. Governor, I'll turn it back to you.
Okay. Like I said on the announcements that I made today, we've got a special session coming up. We got great work, with our National Guard, and we're on the move as far as moving more equipment to Ukraine to be able to help those great people over there and to repel this terrible aggression by the Russians. I absolutely, there's no way on earth we've got the RFP, I think, is what it is, out now, and we should have results back on, just in a very few days. I forgot the date, but early May, and from that we'll start the process in the evaluation of DHHR top to bottom and everything, and it'll lead us somewhere. It'll lead us absolutely to be able to make good decisions, not spontaneous decisions, very quickly put together, but good decisions based on real information and everything. And we'll try to make things where that will improve many, many, many things within DHHR if those things need improvement. Now, with all that being said, I would like to just say just this too. There's been a lot of folks at DHHR that have worked really, really hard over the last couple of years, especially, with this terrible pandemic and everything. And a lot of people have done a lot of good work, and we should be thankful for that, and I surely am. But we're not going to wait around. We're not going to wait around until December the 31st. We're going to come out with the results, and then we're going to try to move forward and make things better. And I also remind everybody just this, of all the deaths that I read today, and I read 19, there was 14 reconciliations, and here they are. The youngest person on this list was 56 years old. The last time I was here on the briefing that we had, I think the youngest person on that entire list was 52 years old. Absolutely, the CDC is saying if you're 50 years of age, you need to get your booster shot. Your 4 shots available to you right now. Every single one of these people just about are in excess of 50 years of age. All these today, and the last briefing, all those. Absolutely, this dreaded killer we know attacks our elderly. And if you're 50 and older and you haven't gotten that booster shot, you're making a big time mistake. That's all I've got. Thank you so much. We'll see you real soon. Thank you.